I just want to show you guys a technique that I used recently on a patient. She had a heel spur, and her spur is right there, right on the plantar aspect of the heel, and the pain is excruciating. It's been lingering for months, and she's done all sorts of different therapeutic applications for it. A lot of really great things. But the spur is clearly there. We had an x-ray done, and we could see that that bony spur is the source of the pain. And we decided to use the Stimpod and see how well it would help. And the first time that I used it for just a few minutes, and it reduced the pain. But when the patient came back the next visit, she said that the pain had come back. Like, it may have helped for most of the day, but it didn't last. And so I decided to tweak the settings a little bit. So I changed two things that made a really big difference. Well, one is we want to be on the exact side of pain. Okay, so, and it's helpful sometimes if the patient's the one holding the actual probe, but that way they can kind of move it around and find the point that has the most amount of pain. Okay, the other thing that we changed is we increased the duration. Instead of just 3 minutes, we went full 10 minutes. And then actually a third point, so three things we did. So one is find the point of pain, and then two is duration, 10 minutes. Third thing was as high the intensity. So as high the intensity as you can handle. So we want to crank this up all the way through the therapy, always as high as we can take it. Of course, it has to be tolerable, but you want to really interfere with that pain signal. And patient came back actually yesterday, and she said that she had no pain for many days. And when she came in, which was a week later, there was a little bit of pain, but nothing like what she had before. So I use this case as a reference case for yourselves when you're using Stimpod for pain. If it's not working, consider, am I in the right spot, right, the right location? 2, how long are you using it for? And 3, what intensity are you using at? And more is often better when it comes to pain, okay? Now, I had another case too that I just want to quickly share, and this was a toothache pain. And this patient actually had been to the dentist, and they did not find anything. Like, everything seemed to be pretty normal with the teeth, no infection or concerns. And so at first the pain, not only was it in the tooth, but it was also on the left side of the face. So immediately we're thinking trigeminal nerve. So we use a Stimpod on the trigeminal nerve, and it's 3 branches. And he came back for a second visit. All of the side of the face sensitivity really was gone, and it was not pain in the face, it was sensitivity in the face. But the toothache was better, but still present. So we decided to only focus on the tooth only for an extended amount of time and increase the intensity. And initially, after application, it was a lot better. And it's, we'll have to wait and see if it lasted. But I have seen that work with other patients as well with toothaches. Hope this was helpful to you, and up to next time, have a great day.